Today on The Reality Pill, it's an honor to have Dr. Neinstein, an incredible plastic surgeon from New York. He is one of the really fast-growing young surgeons there, bringing newer techniques into the world of plastic surgery. He lectures, authors, teaches, and he's growing a massive practice in the nicest part of New York imaginable. It's an honor to have him here talking about liposuction, heat-based therapies, everything we really don't know much about as patients and really continue to learn as surgeons.
The main topic for today with our amazing specialist in lipo and non-invasive and plastic surgery in general, I think we should start, well, you're a teacher too, so
yeah.
I wanted to start with the basics, and the basics that I think we can kind of present everybody is what is a plastic surgeon? What is specialization? And what difference is there between somebody who's board certified, not board certified? You know, can somebody be good who's not board certified, or what are your chances that you're taking? And then really just kind of seeking out the right person. So if you could just explain your background, you know, that we went over,
Sure.
and then we'll kind of go through how
you know, plastic surgeons, seems like we clicked in. I'm clicking back in here. Okay, so where I come from in Canada, you train in general surgery, then you specialize in plastic surgery. And so you start, you know, this wide, sorry, my screen's here, and in general surgery. Then you go down to plastic surgery, you go about this wide. And then within plastic surgery, you know, we learn burn, trauma, hand, etc. One thing that interested me was cosmetic surgery, which is another smaller part. So that's why I decided to go and do a fellowship to learn more. So now you've gone from here in general surgery to here in plastic surgery to here in cosmetic surgery. And now, you know, I've decided to basically take one procedure out of just cosmetic and make that my expertise. And the reason for that is I enjoy, you know, I can't be everything to everyone, but I can be something to someone. Me and my team like focusing 100% on one thing and knowing that there's no such thing as a perfect operation, but we think from customer service and technical delivery that we can do that on every case. In terms of who you should go to, you know, I believe anyone could be great at anything if they truly commit to it. You know, I think that there's great nurse injectors out there. There's probably great, you know, surgeons who are trained in other fields who are great at procedure. It's tough to get the notoriety for that. But if I'm out there looking for a procedure or I'm referring patients, I'm typically looking for a board certified surgeon who is highly focused and specialized in the area of the surgery that I'm looking for. So that's simple.
And I agree. And so to explain what a board is, a lot of people don't understand. There are boards, we'll explain what a board is, but there are boards that don't matter and there's boards that matter. Okay.
So you go ahead.
I was going to say, I mean, some people have 5 board certifications, and some of them could be from the aesthetic surgery board and from the, you know, toenail clipping board. Like, you know, these things, you can form any board overnight, but they are not nationally recognized or accredited boards.
So there's the American Board of Plastic Surgery, and then there's other boards such as I see, you know, the American Board of Cosmetic Surgery, the American Board of Cosmetic Laser Surgery. It really just means whether someone has done the right training and had the right examinations to prove that you know, that they monitored through that training. And I have to admit, coming from Canada, which is a lot simpler, the American system is hard to navigate. You know, in Canada, everyone at the end of training just writes their exams and that's it. There's no gray area. It's like, you know, one day you're a student, the next day you're an attending. So
here, like, to kind of delineate it for people, the process for the American system is you go through medical school. Medical school is after university. That makes you an MD. It doesn't make you a licensed MD, so you're not allowed to practice yet.
Yeah.
You need 1 year of practicing or 1 year of residency or internship in order to get a general license. After that, you do your residency, which means you're training in something specific, meaning either general medicine or general surgery, and you become a specialist in that, and that is governed by a board. So a board will give you an examination and you take it and you pass it, now you're board certified, then you become subspecialized into fellowship. So yours is plastic surgery. And in plastic surgery, what are your general thoughts on people who do everything?
Well, I think it has to do with where you live. I mean, if you live in the middle of nowhere, you probably need to do everything. It's probably essential to, your community. But I think if you live in a dense environment like New York City or Los Angeles, you have the opportunity to, pick out your niche. And I think you got to find something that fits your personality. I don't think you could be forced, you can't square peg in a round hole. If you asked me to do facelifts all day, it just wouldn't work. But, just my personality, the way I think, the way I visualize the world, the way I think, technically in 3D, just works body wise. What about you? How did you end up deciding to do face?
So I got into it from doing first head and neck cancer. So I was trying to become a head and neck cancer surgeon. And as I went through it in my third year, I started crying a lot because that's when I told people they had cancer, and I didn't realize that you had to do that. So
Gotcha.
I was crying every day, and I decided to lean more towards the reconstructive part of it. And then from the reconstruction, I saw that the more difficult, in my mind, the more challenging and the more aesthetically technical stuff was actually the cosmetics. So I started going slowly into cosmetic from there. I did 2 fellowships though. One of them was facial cosmetics and and reconstruction. The other one was pediatric birthmarks and lasers. So I was going to do all of it. And I came back to Beverly Hills, and Beverly Hills just took me off in the cosmetic direction because we're,
there you go.
Yeah, we're in the middle of all that. And I try to guide people all the time when they say, I don't understand how to find the best surgeon. I try to explain to them, it took me med school, it took me residency, it took me 2 fellowships and several years of practicing before I figured out who was good. So it's really difficult. So if we're trying to guide somebody, let's say for the bigger cities, something like this, to find the best doctor and really the best results, first we give the kind of generic advice of, well, it's obviously much better to have a board certified surgeon. At least they went through some kind of approved training and testing, and they continue to do so. If you don't do that, you're at pretty high risk. So if people do something out of their realm of expertise, a lot of things can go wrong, because even when you're an expert, things can go wrong.
That's true. Yeah, I mean, it's also, people ask me all the time, probably about you, about discounted surgery, whether or not it's, somewhere within the borders of the United States or out of the country. And, the only thing I can always say, when something's discounted, it's usually on safety or quality. And, there's really no other way to discount anything. If you want to have the proper equipment and staff, it just costs X amount of dollars, period, full stop.
Yeah. Yeah, I agree. And so when I guide them, I tell them, listen, you got to really do your homework. You got to do tons of homework. So I advise them to look at the board certification, look at the training, and then look at the person's experience. And the only way you can look at someone's talent and experience is really to go through their before and after photos. Like, I don't know ultimately how else to do it. So I don't know if you have any other advice on like finding the right doctor.
I always like getting referrals from other physicians in the area, knowing that most docs have no skin in the game for giving a referral, except that, a referral is an extension of your own practice, right? If I'm sending someone to get their eyes done or their nose done, in my mind, that it might as well be me doing it, because that patient's, taking my advice on that. So I take that pretty seriously. But another thing I wanted to ask you, Pete, and one of the reasons I love body work, it has a very low psychological burden, meaning, my follow-ups are, a few seconds long. My stomach's flat, my waist is tight, see you later. Not much to talk about.
Yeah.
So one of the things why I didn't get into facial plastics was some of the, sometimes you can do a great operation, but, you start getting into that gray area where, the operation's great, but the patient doesn't like it. So it's a lot more mentally, it's a psychological, game.
Yeah, so I didn't tell you about my third specialty, which was clinical psychiatry. So going through the facial cosmetic realm, you're exposed a little bit more, especially as a revision rhinoplasty surgeon, to body dysmorphia and things like that. And some people tell me they have body dysmorphia, which I tell them, well, if you're aware of it, it's unlikely that it's very substantial. But you do see a lot of that in the face world, especially in Beverly Hills. But it's part of my life now, so I don't even notice it anymore.
Got it.
And it's part of my job. So it's part of my job as far as making people feel better anyways, whether, I think the requests are nutty or not, or their, expectations are kind of.
I think I see a lot of people asking, what do I do specifically? So maybe I should just give a little breakdown of what, the difference between traditional liposuction and what modern liposuction is.
Yeah, I mean, that's where we're going next anyways.
So, okay. So, traditional liposuction was they'd bring you to the hospital, they'd put you to sleep, they'd pump numbing fluid under the skin into the fat. And it was typically done in patients who were, didn't take care of themselves at all and were looking for surgery to replace any type of diet and exercise. And they would use big garden hose style instruments, and it was a big, rough procedure. A lot of downtime, a lot of inflammation, a lot of trauma. It wasn't pretty, and the results weren't great. The results weren't great because of the surgery. The results weren't great because of the patient selection. And now we know, 30, 40 years later, no matter what you do, it's not just the surgery, it's making sure the patient's the right patient for the operation. So the typical operation we're doing now is we're seeing, younger patients who are not looking for surgery to replace, something in their life. They're looking to take care of a stubborn area that diet and exercise can't do. So, they're happy with their bodies, but their chin, their lower abdomen, their waist, their inner thighs, something that they can't get rid of in the gym, and it bothers them, whether it's, genetics, hormones, or pregnancy. So most of the time on the day of surgery, we'll bring someone in and we can either do full sedation or light sedation. Most patients now opt for lighter sedations, which means you don't have to have a general anesthetic. So we bring you into the operating room after giving you light sedation outside. We gently put the numbing fluid under the skin into the fat. But instead of having to remove the fat aggressively, we can melt it now using technology. So once we can melt the fat, we don't have to use a garden hose style instrument. We can use a stir stick style instrument. And we can do this quickly and efficiently in our quad A operating room. An area like the abdomen and the waist takes about 65 minutes. The patient's in the office for about 2.5 hours. They go back to work in 2 days, compression garment for about 3 weeks. We have them seen in our office, at their leisure for a couple of lymphatic drainages to get the extra fluid and swelling down. And, we only see bruising and swelling for about a week. Second week, they're back to baseline, and then things just tighten over that. And the skill and art in liposuction is not about what you take, it's what you leave behind. And understanding, being able to leave a little bit of fat underneath the skin so everything lays down nice and flat is the key.
Yes. And so that's actually what I wanted to ask you through the questions of liposuction that I have, and that I've seen with the face as well as what I've seen with the body and kind of irregularities. So with liposuction, everybody wants to get fat sucked out. The things I worry about, and there's two things that I'm asking you, are, number one, is there too much you can take? What happens when you take too much? Okay. And the second is, what about the longevity of this? So if you look at somebody who is liposuction now versus 20 years from now, what's the consequence on their skin quality, rigidity, resilience, that kind of stuff?
Sure. So, on average, or you don't want it, in general, the goal of liposuction is to make you look as good as possible, but as natural as possible. Okay. Other parts in the world are a little more aggressive, where they're not trying to make you look as natural as possible. They might be trying to make you look as, awkwardly thin as possible. But here in the United States, and especially New York, our goal is as good as possible and as natural as possible. So that means for me, when I'm in the operating room, I'm taking as much fat as I can, that when the skin lays back down, that it's nice and flat. Okay. In terms of absolute values, if you want to think about it, the average person's going to have about 2 or 3 cans of Coke size of fat removed. Okay. The max you can take, which I actually wrote in the maintenance and certification guidelines, is 5 liters. And the reason for that, it's just a general number. It actually varies state to state. Florida, it's less. But the reason for that is just to set a firm guideline of no more than 5 liters of fluid out. And that's fluid plus fat. And the reason for that is after that, there's too much fluid shifts and it makes it too hard for the heart to pump. The heart needs to focus on pumping blood and not worry about other things. So on an outpatient basis, you shouldn't be doing more than 5 liters of fat removal. If you're going to be doing more than 5 liters of fat removal, that means you're admitting them to the hospital. I think that just sounds ridiculous in 2020 that we'd be using, doing inpatient high volume liposuction. They do it in other countries, but we don't here. In terms of the longevity.
Wait, hold on. So before you go to longevity, what about skin irregularities? And there's something here that I've heard called skinny bitch lipo, which is like skinny girls who want to get lipo, including models and things like that. So what happens to their skin in terms of if you lipo too much in terms of coloration or adherence to the muscle?
We're the only job in plastic surgeons are the only, people in the world who all their complications are from working too hard. It's like they just take too much, but I get it. The hardest part about teaching a resident in lipo is to tell him or her to stop, because they see it coming out and they just think, oh, wow, this patient's going to be so happy when all their fat's removed. But the only type of people in the world who walk around without any fat are burn patients, and nobody thinks, a burn patient, it looks, aesthetically pleasing. So the whole goal of liposuction is to leave fat behind. And once you have too much, the issues with skin irregularities are, number one, too much fat removed. Number two, thermal injuries, right? Because people are using all this great technology, but they're using it without really proper training, just like everything else in life. They're giving people, you can buy a Vaser and a J Plasma, which are amazing devices, and I use them on every liposuction case. But we see, too much thermal injury with with almost no fat left. So where does the heat going to go? It's going to go into the skin. So those contour irregularities, which we all see, the Tara Reid figure, the fibrosis, are really difficult to treat. We have a number of different ways we do that. If you catch it early on, something like hyperbaric oxygen, I know facelift surgeons are getting into that. Anything that you can pump, oxygen into the skin. But now, if we see a late fibrosis, or skin irregularity, we'll usually try to soften them up with lymphatic massage, and then we'll do some microfat injections to try to get some rejuvenative quality effects of the body into that area, and then, go from there.
And so what are these? Also, Tara might be listening actually, because she's actually going to talk about this stuff later too.
All right.
But how does this actually look like when you're seeing these irregularities on the skin or under the skin? What does it actually look like? Like
rippling. It looks like snakes, within the skin. It does not look good and gives liposuction a bad name. That's why in my practice we call it liposculpting, because I was like, anyone can suck fat, but it's much more difficult to sculpt bodies. And, if all the teaching I do, around the world and in the country, I'm literally just saying, as you're doing the procedure, just simply, pinch everywhere and leave a thin amount of fat. You just work less, you'll get a better result, but it's hard to teach.
Yeah, and then internally, you probably see what I see in the face, which is adherence of tissue planes, meaning you don't have that natural several layers anymore. It's like you have a nice, Big Mac, and then somebody stripped out all the inner layers, and you just have two pieces of bread. It's kind of all stuck together without really the good parts left.
Yeah, and listen, even in the best intentioned procedure, you can have, some fibrosis. But when skillfully done, a lot of the times we can, rescue those patients, at least give them something that they can live with on a day-to-day basis.
Yeah, and then what about longevity? So that kind of goes into the next part, is how skin ages and the resilience of the skin and things like that. So
the better quality skin, the better quality results. So luckily now we have better technology to help with skin retraction, such as J Plasma. J Plasma is a good tool for tightening skin, but it's not a magic wand. If you need skin removed, you need skin removed, just like every procedure on the neck and the face. In terms of the fat, people always want to know, does the fat move around the body? It's the number one question. I think people always think that. After puberty, we don't make any new fat cells. So all the fat cells that are removed are gone for good. The cells that remain can grow and shrink with your diet. Now, 7 to 10 pounds, Christmas and Thanksgiving, I don't get worried about. That's not going to make a difference. If over several years you're gaining significant amounts of weight, 5, 6 pounds a year, you will start to notice, different amounts of fat in different parts of the body. But after, almost 1,500 cases, I haven't seen anyone with significant, change that required any more surgery. People who do these procedures are keeping their body weights. These are people who are committed. It's not a weight loss procedure. It's a body sculpting procedure.
And have you seen, so the J Plasma is a helium-based plasma device. Plasma, it's an explosion of molecules outside of, it's like a fire wand, basically.
Yeah.
But what are the real actual risks of that? Because a lot of people don't have experience with it. You do.
Yeah. So we've done about 500 cases, so we take a helium tank, the same that, the circus would use to blow up balloons. We put it through something that looks like R2-D2, and it comes out this little purple flame, which is ionized helium, and it allows us to put the most amount of heat into the lower part of the collagen of the skin without burning it as possible. So if you think of the collagen in your skin, as like a loose shoelace knot, the ionized helium is going to tighten that up. And one of the issues with the ionized helium is that it works really well, but it probably works too well, in that there's no off switch and it doesn't have a temperature monitoring device. So it really takes a lot of understanding of how to use it. So a lot of the early issues with the device where people are dragging it along the skin, dragging it and putting it right into the dermis. What we know now is we're going much deeper, closer towards the fascia, which is farther away from the skin, and really using it to tighten the connective tissue framework, meaning bring the skin down to the muscle as opposed to trying to shorten the muscle just like that, or shorten the skin just like that.
Right. So actually tightening the ligamentous type attachments, the reticular bands.
Exactly.
Like
and we use it I use it in combination with Vaser. So in my mind, the easiest way to do liposuction is, you melt the fat, you can basically take it out with a tiny stir stick, you melt it with the Vaser, you take it out with a tiny cannula, the less inflammation, the least amount of trauma, you're barely there, 1 millimeter incision. And then you use the new J-plasma cannulas, which are also 2 millimeters. And we add heat to tighten the connective tissue framework, and you're out. It's the least, is the most predictable, safest way to get the max amount of body contouring possible. And it's not about just simple fat removal anymore.
Right. And so, I think anytime you add heat to liposuction, you're introducing, it's a higher technical expertise that you need to get it done. So what happens when somebody goes to somebody who's not good and somebody, who's really not, and it's hard to decide, but what happens when somebody who's not good does J-plasma or Vaser or heat-based lipo?
Just like anything else, like a Fraxel or any other device, you just hope, most people who go into medicine are, just going with caution. And, you need to use each individual patient, make sure that, make sure they don't have a connective tissue disease or have any other thing that's going to make them more susceptible to a burn. And just like anything else in life, start low and go slow. Don't try to push, your first case shouldn't be your most aggressive case.
Yeah.
And, we should be hitting singles, not home runs on every, you don't want to be Babe Ruth, right? You don't want to have the most home runs and the most strikeouts.
Yeah, that's actually a good way to look at it. Nice, steady improvements, never take anybody down.
Yeah, exactly.
And with all this fat that you take out, I know a lot of plastic surgeons who specialize in lipo, they do fat transfer. Some of them do minimal, some of them do maximal stuff. I have questions about specific types.
Yeah.
Okay, the reality of certain types of body contouring. But what's your take on it in general for BBL and that kind of stuff?
So most of my patients are looking for a solution to a stubborn area of fat. And they're also looking for something minimally invasive. So when you start doing things like a BBL, which I very rarely do because first of all, it's a very dramatic change to the body. And second of all, you're adding a lot of downtime. So, typical patients I see are like, hey, my lower abdomen bothers me, not my lower abdomen bothers me and I want a bigger tush. It's just get rid of this lower abdomen. So large volume fat grafting to the buttock, I'm not doing. The most common area that I do is micro fat grafting to the tear troughs and nano fat grafting right into the dark circles of the eye. And then we go into some breast fat grafting. But majority of our procedures are straight body contouring. But when we do fat grafting, so micro fat to the tear trough and breast fat graft. I almost never do buttock fat grafting.
Okay. And with breast, do you sometimes do that in place of implants or with implants, or how do you do that?
I always tell patients that breast fat grafting is great because you don't have to have a foreign body. You can usually get about a cup size. If you're looking for more than that, you're probably going to need an implant. It's great for more changing shape than changing size. The reason why it wasn't popular for a long time was, number one, people thought that radiologists couldn't tell the difference between a breast cancer and a scar from breast surgery. So they were worried that after they had fat transferred to the breast, their mammogram, they would just be getting biopsies all the time. That's been proven wrong. So they could tell the difference. Number two, the technology wasn't that great, just like everything else. So now we use what's called a closed system, meaning the fat goes out of the body, purified, and goes right back in, never exposed to the air. So, if I tell patients, if you eat 10 pieces of fat from, used to 3 or 4 pieces would survive. Now 7 or 8 survive. And we do this, with our light sedation cases too, because we can just have it all through that closed system. So breast fat grafting, we call it a breast boost. It's more common. So we like it for patients that don't have droopy breasts, because it's just going to make droopy breasts droopier and heavier and are just looking for a slight increase in size. and it works out great.
And the reason you stay away from the larger volume fat grafting?
Fat has to have a home, and I'm always worried two things. You can get the fat emboli, which is the death sentence, and those issues are real. I know everyone says they can do it safely by staying under the skin, but I just choose not to go down that road. And number two, fat has to have a home in the sense that it has to have good blood supply. So I'm worried when you put this huge amount of fat in somewhere, eventually, more than often and more than we probably know, that fat isn't going to have a blood supply, and it's going to turn into a pool of infection.
Right. Yeah. So the larger volume you have, especially in one area, it can certainly do that in the face or the body.
Yeah.
The kind of fat grafting that I've always been curious about is sculpting in terms of pecs, shoulders, abs, that kind of stuff. What I wonder is you are now becoming very creative. Okay, so
yeah.
When you become creative, things can go wrong from what I've seen. So let's say somebody naturally has fat in the buttock or the hips, and you're kind of just accenting it a little bit or adding. I get that. Let's say now you're really trying to sculpt somebody as though they're a stone sculpture, and you're going to go in and you're going to sculpt some abs. What happens to them in the future if they get hormonal changes, weight changes, everything?
So there's a lot of outliers in our field, okay? So the average person coming in to see me, most plastic surgeons do 30 liposuction cases a year. We'll do 65 a month. So, and I can tell you 95% of the patients who come to see me are no one's asking me to look weird, okay? They're not saying I want to look like Batman, or the Batman costume, and I want you to take all the fat and put it in my shoulder or my bicep. So there's outlier plastic surgeons, and a lot of them are very smart, very creative people who, as we know, that's who outliers tend to be. But I just don't, partake in these procedures. I know I've seen a lot of these people, a lot of these patients look just crazy a couple of years later. If they take all your fat and put it in your pecs, and then you gain weight in your pecs. I mean, which sounds great, but if you gain like 30 pounds, you can look ridiculous. I mean, so I think you want to, I tell patients, simple, common sense, straightforward, just do, everyone's busy. They got kids, don't do this crazy stuff. Just get in, do the safest, most predictable operation, accomplish your goal. But definitely, there are outlier surgeons who put on, pretty wild, websites and, are actually interesting, safe people, but just do outlying, surgery that's cartoonish and not for the average person.
Yeah, and I see the more cartoonish you get, the less reparable it is. There are certain things in plastic surgery that I won't do because they can't be fixed. And I realize that when I'm doing any of my surgeries and any of your surgeries, we might have issues. We're intentionally hurting somebody in order to make them look better, or we're damaging them in a way. So they have to recover, first of all. We're worried about that. And then when they do, you want everything to be natural and normal. The more abnormal it is and the more you change it, the harder it is to fix. So I always worry about these things that become really creative, Yeah.
They look good on a two-dimensional Instagram picture, but it's not something you want to be walking around for the rest of your life. A lot of these patients are working in Midtown Manhattan. You want to walk into, a board meeting a week later looking like a crazy person? No, they just want to look as good as possible, as natural as possible, as quickly as possible.
Yeah, and people don't know if they're going to gain weight in 10 years, 15 years to a substantial extent. They don't know if they're going to undergo hormonal changes. So I don't do lipo so much. I don't know the body. What does fat in the body have, what relation does it have to hormones or hormone receptors?
I find it's more genetic in the sense of that, patients come in and they'll say, this is where my fat goes in my body, and it's the same in my mother, the same in my grandmother. We do see changes. So that's one thing that's ubiquitous amongst all patients. Wherever their fat deposits are, I know that if I have a scoop of Ben & Jerry's tonight, it's going to go to my love handles. And, my father could have told me the same thing. My menopause patients tend to get, a very specific pattern of fat accumulation, which is they get fat in their lower abdomen, and then they get laxity in their arm skin. So, definitely all plays a role. But what's interesting now is that so many patients are on bioidentical hormone replacement, so it's hard to track what's happened. I don't know if it's too much or too little. So
yeah, so the thing I think about, or the discussion I have with patients when I'm doing facial fat grafting, and I do very conservative amounts, is that it may sound natural that we're doing this, but we're not doing something natural. We're taking fat from your ass or your abdomen and we're putting it in your face. It is from your body, but it's a different quality fat, and it's got different flags on it. And so your body may respond differently in that area where you grafted the fat than in the areas around it when you gain weight, when your estrogen levels or progesterone levels change.
Are you stopping? Do you keep patients on hormones or off now going into surgery?
I do such little fat grafting stuff that doesn't really come to mind. But
what about just safety in general? Because I know the plastics.
I try to get them to stop if an endocrinologist didn't put them on it. So if an endocrinologist told them, listen, your levels are off and this is where you need to be, then yeah, for sure, I tell them to take it. But if it's somebody who's trying to get like jacked,
anti-aging clinic,
and they went to somebody who has zero like brain juice, and they're telling them, here, I want to put you on HGH, testosterone, and all this shit. You're messing with your metabolism, and I tell them, I don't know what's going to happen to your heart.
How many patients are on it now?
I try to tell them, listen, like, you remember Andre the Giant? Like, yeah, I'm like, Andre the Giant, he's dead.
What do you think about all these plastic surgeons bringing in, longevity doctors into their practices and offering that as an extension of their wellness?
There's different ways they do it. There are the ones who specialize in like naturopathy and holistic stuff, which I believe can help. There's the ones who are diet and fitness based that are great. And then there's the ones who are just popping out pills and doing HGH, testosterone, and hormonal modifiers to everybody, which is, people go through years trying to normalize this stuff in their body, and it never gets right. So I'm always scared for them when they do this. Like, you've seen people on thyroid hormone, like they come in I'm like, whoa, what's your dosage? Oh, 100. Next time, 77. Next time, like, they go through this their whole lives. So yeah, I'm always concerned about it. There are definitely patients who can benefit from it, but I haven't met a genius yet in the world of endocrinology who's able to predict really consistently like what someone's body is going to do. So until I meet that genius, I have my reservations.
Yeah, I see a lot of people adding, the wellness, the anti-aging, the, like the Tony Bosch biogenesis, whatever, like the Jose Canseco stuff. But, it's out there. It's not going anywhere. So it's got to be something that we all got to learn more about, because more and more patients are on it. What new things are you adding to your practice that you think people are looking for?
Well, my main thing right now is I'm coming away from injectables myself. So I have a nurse practitioner who's doing that stuff. And I've just more and more been trying to specialize myself. So just as we were talking about in the beginning, instead of adding new things, I'm trying to like really get better and better and better at facelifting, lip lifting, eyes, and that kind of stuff. So I actually recently haven't added anything new. For a while, I was doing a lot of PRP with nanofat treatments, and I still do a good amount of them, and it's very vague and poorly understood to me how it works.
Is that for hair?
For hair and for deep scarring. So for contractures, fibrosis, and areas that are like desmoplastic, I've seen like big improvements with it. I don't know how it works, but it works.
Gotcha.
So I don't even know what to tell people about that when they ask me.
What's interesting in body is we keep adding, even though we're specialized on lipo, we can keep adding services that complement, body sculpting. And lymphatic massage, I don't know how popular it is in the facelift market, but lymphatic drainage has become, the biggest thing in my practice. We had it going for all of our post-op patients, and now we keep getting calls from people who haven't had surgery who want it, and all our post-op patients who just want to continue having it for the, the detoxing and the lymphatic drainage. It really gives you this resolving feeling of, that you're detoxing your body, get rid of all this stagnant water, and everyone likes a massage. So we we're adding more, and it's nice that, what I find nice is patients are really enjoying the human touch. So not everything is like a robot, like M-Sculpt in my practice. It's nice to have all the fancy technology, but it's nice to have, a lot more human touch in the practice, which is a great touch point for our patients. And I think more practices, we'll see if they start bringing in masseuses.
Yeah, so I love lymphatic massage. We've added hyperbaric oxygen treatments and LED and that kind of stuff for healing, but lymphatic massage is great. And it's also great for discussion for the patient because they don't understand a lot of the time what lymphatics are. And I try to explain to them, we've got arteries and veins that carry blood to and away from the heart. And then we have lymphatics that gathers all the tissue that leaks, or the fluid that leaks into your tissues and carries it back. And anytime we do any surgery that's going to elevate or detach skin, we are going to naturally have to detach lymphatics and nerves. And lymphatics and nerves tend to grow back at about the same pace, which is at 3 months, you'd see maybe like a tiny bit grown back. At a year, you see probably 80-90% grown back. 3 years, you see 95% grown back. And when you do these surgeries, you're impairing the lymphatics just as much as you're making something numb, whether it's on the face or the body. So lymphatic massage actually helps jumpstart that process before your lymphatics really come back into full effect. You can help drainage of the face, the body, and everything, and it helps the areas carry less water, be less swollen during that time. The question I've had from patients, though, is what is lymphatic drainage issues the same as lymphedema?
No, yeah.
Okay,
lymphedema, lipedema, I mean, it gets more into it. But what I see in New York, and I see in LA because it's the same businesses, is that there's a lymphatic massage, salon opening on every corner now. And, I think a lot of places they're just, touching you, but they're not actually doing a proper lymphatic drainage. And, I think this is something where surgeons are going to have an opportunity to actually lead the way and put these reputable masseuses into work in their offices and give them a place to own their skills. And I think that'll be a valuable resource for doctors going forward. We'll see who adopts it and who doesn't.
Yeah, now in the world of emerging technology, like you said, the M-Sculpt, we have a robot versus somebody having their hands on you, there is something tremendously therapeutic.
For sure.
Well, obviously lymphatic massage is probably the most hands-on kind of therapeutic thing you can do after a procedure, but you are having somebody who has healing in their blood, like, a healing person help you and touch you. And I think that itself plays like a large role.
I also think just the fact that someone who just had a surgery, even though ours are minimally invasive, the fact that they're in your office for an extra hour or two the week of the procedure, just knowing that they're in your care and that their whole team is around you, offers a lot to the psychological, benefit of the patient. And just having massage therapists, I apologize, someone was saying that, but, we're having people ask for even medical massage and from these well-trained massage therapists who, are amazing healers really and play an integral part of the healing process.
Yeah, and have you been using hyperbaric oxygen or anything like that?
I mean, we talk about space limitations in New York. I can see my wife waving at me. I got to get going in a minute or so. But no, I haven't been using hyperbaric oxygen.
Okay.
Yeah, but I know some of the facelift surgeons around have.
Yeah, it's incredible for facelifts. So if we're finishing up the calls, let's go over some questions we have over here.
Yeah.
So we've got if Sculptra is safe to fill. This is actually interesting for you. Is Sculptra safe to fill the hip dips and make a bigger butt? I've seen a lot of med spas in LA offering this procedure. So that I'd say if you could answer that in terms of like little tiny bits versus a lot and what actually it's doing.
So Sculptra is, take a bunch of sutures, put them in a blender, and you get Sculptra. It's basically Vicryl in a blender. If you dilute it down to something that looks like milk, it's good for building up the bone. If you dilute it down to something like a snow globe, it's good for fixing dents in the skin. I think I've never been impressed with the full, using a large volume of it because it's just creating scar tissue. It's not really creating something that resembles the natural tissue of that area. So I like Sculptra for fixing little dents on the body from body work, but I don't like it for primary augmentation of large areas like the bum or the hip dip.
Okay, and so people understand what Sculptra is doing. It's helping with fibroplasia, so forming different types of collagen.
Scar.
Yeah, scar tissue, exactly. So if you look at it, it looks like gray fat is what it looks like very dense gray fat that's not as soft. So we use
I do like it for fixing little dents here and there. I think it works out pretty well. It can help thicken up a little bit of skin on the body, but you don't want to be using it for primary augmentation.
Okay, so we talked about J plasma. I'm pretty sure we're both familiar with BodyTite. And then so what's your opinion on BodyTite and wand-based devices?
Sure. So I think no matter what, it doesn't matter the tool. It matters the person holding it more than the tool. I think BodyTite and J plasma are both good energy devices. They're both devices that put energy into the bottom of the skin. They just do it in a different way. One uses bulk heating radio frequency, which means you got to heat the whole room in BodyTite, versus spot heating, where you can just heat one point on the wall, which is J plasma. BodyTite is much more user-friendly for the average surgeon. It's probably much easier to use. J plasma, much steeper learning curve, but I think a lot more, you can push the envelope a lot more as you get better with the device. Both are great devices. Both are great companies. And I think you just want to make sure you're going to a surgeon who really knows how to use it. You don't want to go to someone on their first time trying it,
All right. So the next one is just about when you're doing tummy tucks, what's the real risk of necrosis on somebody?
It's very rare. Unless you're a smoker, connective tissue disease, or BMI above 35, it's going to be incredibly rare. I mean, it really shouldn't happen.
All right, cool. Okay, so I say we can call it now. The information, if you guys need more, Dr. Neinstein, it's I think it's just DrNeinstein.
Yeah, and anyone, if they want to hit me up, we are doing virtual consults next week. We have a few left on the schedule. You can get it through my profile page, or if you want to DM me any personal questions, I'll be happy to get back to you as soon as I can.
And what's your website?
This is NeinsteinPlasticSurgery.com. It's on my profile.
Where is Neinstein Plastic Surgery going to be in end of 2020?
5th and 58th above Bergdorf Goodman.
The fanciest place in the world.
That's it. Our patients deserve the best, so we're fancier.
That's fancier than Trocadero in Paris.
Well, they want it, they got it.
I think it's awesome. I'm going to come visit you for sure.
Yeah, of course. We're going to have 2 operating rooms.
All right, Dr. Neinstein.
We'll have to come operate over here.
Yeah, I'd love to. All right. Well, thank you so much.
You got it. Take care.
All right. Take care.